Researchers at OU Health have released alarming findings of a 15-year-long study that focused on treating type 2 diabetes in young people. Steve Shaw talked to the doctor who led the study. Steve?
Jason, there is real cause for alarm. This exhaustive study, called the Today Study, found that young people are developing type 2 diabetes at an accelerating rate, and it's much more aggressive than type 2 diabetes found in adults.
Dr. Jeannie Tryggestad led the Today study that in 2005 followed 699 children for 15 years, kids who'd been diagnosed with type 2 diabetes, which is a condition that affects the way the body processes blood sugar. It eventually can lead to blindness, kidney failure, and death. Statistics show the Sooner State is the 5th worst in the United States.
Hey, what's the number one culprit with kids? Is it soda?
It's hard to say that there's a number one, but sugar-sweetened beverages definitely play a role. We know that people of racial and ethnic minorities have a little higher propensity toward type 2 diabetes. So our populations that have influences from the Hispanic culture, from Native American cultures, we know that there is a higher risk in these groups. There also is very much a socioeconomic factor that plays into this. And those that have lower resources tend to develop type 2 diabetes. In general, things like fresh fruits and fresh vegetables, unfortunately, are higher. They cost more. So to be able to feed your families, lots of times we do resort to those things that maybe aren't the most healthy, but will provide a meal that will feed a larger family.
Tryggestad has family members who are diabetic.
Within 4 years of their diagnosis, they were already requiring multiple drugs, multiple interventions. They had failed their primary therapy. If they were on at least 2 diabetes medications, they did a little bit better. But it was shocking at how rapidly these youth progressed in their disease and how aggressive their diabetes was. And this is more aggressive than actually we see in adult diabetes. We actually had 6 deaths in the study related to diabetes and its complications. And these are young adults that are around 25, 26 years of age. We had events like strokes, even cardiac failure, heart failure, and heart attacks were occurring in these youth. All of them are really under the age of 25.
State Senator Carrie Hicks has an 8-year-old son who is diabetic. She was instrumental last year in getting a law passed that makes it more affordable to buy insulin, which is something diabetics need access to about every day.
When I came into the legislature in 2018, I was really upset about Big Pharma because that's kind of what I had been led to believe was causing the rise in costs. So I sat down with them. We went through all of the data and, they acknowledged that they have a piece, of the puzzle, but there were many, many other puzzle pieces I was missing.
She says the global pandemic complicated solving just an incredible problem.
I think it's just important to always give grace and space and acknowledge that it's a very difficult situation that we've just come through and we're not out of the woods yet. I also think that it's really important to consider parent education and the parent influence on what we're seeing in young people. A lot of times, young people don't necessarily control their diet, particularly in the home. And so making sure that parents understand, the quality of those nutritious foods and why it's so incredibly important for young people to have access to fresh fruits and vegetables.
The Today study partnered with several groups, including members of Cherokee Nation, Choctaw Nation, and the absentee Shawnee tribe. Lisa Harrington is a certified diabetes education specialist with Absentee Shawnee and works out of their clinics in Shawnee and Little Axe.
It is scary. We are seeing more and more, and I think that's why we've been so passionate. So I am currently the camp director for Native Youth Preventing Diabetes, and we are a coalition of many tribes in Oklahoma, and we come together every year for a week in the summer.
Here in this demonstration kitchen inside the Little Axe Health Center, tribal members from across the state not only learn safe principles of handling food, but also how to make healthy meals.
But then we have a specific focus on teaching them about type 2 diabetes, how to prevent it, and live.
And you hope they will pass it on.
We hope so.
Can we all agree that lowering insulin prices would help?
Absolutely. But you know, even medications beyond insulin, just trying to make all diabetes medications affordable would go a long way.
And they're not right now.
Many of them are not.
I think absolutely they're listening, and I think the other misconception is they don't want to try, and that is not true at all. They do want to try, and my feelings in working with these families is that a lot of them are at a loss to knowing what to do.
According to Lisa Harrington from the absentee Shawnee tribe, 14.5% of the American Indian population has a diabetes prevalence rate, which is the highest amongst any race or ethnicity.